Cry It Out Loud, a podcast by Chasing the Rainbows with your host, Bernice Quisenberry.
This week's episode is called Genetic Testing Out Loud, and it's with Erica Schindewolf, who is a senior genetic counselor and specialist working for a major hospital system and also a baby loss survivor herself and a mom. Thank you so much for being here for our survivors, Erica. Welcome.
Oh, thank you so much for having me and for organizing this. I am such a fan of the podcast and all of the work that you do at Chasing the Rainbows. And so I'm just so happy to be here. And I hope that we can make people feel good and cared for. So thank you so much.
Absolutely. Oh, thanks for saying that, Erica. Yeah, it just means so much. And if you could share just a little bit more about yourself and your story for our listeners to hear.
I would love to. So, where to start? So I have been a genetic counselor for the past 10 years. I'll do professional first. And I've mainly worked in fetal medicine, taking care of families who are pregnant or who maybe are going to be pregnant and have a history of loss or a history of birth defects or genetic conditions. So I have been really honored to be in that space with so many families as they've navigated through everything that we're going to talk about today and everything that you do so well to advocate for families. Personally, I started my career before I became a mom and before I became somebody who was going through a fertility journey. And so I was really fortunate to be one of those people who got married and got pregnant right away with my daughter and had a pretty uneventful pregnancy outside of it being during COVID and having to navigate that space. But when we tried to conceive for our second pregnancy or for our intended second baby, we experienced secondary infertility, which was somewhat unexpected. But I think also when you do the work that we all do and you're in it with lost moms, you kind of almost imagine that it's going to happen to you because it feels, it just feels like it happens to everybody. And so when we went through our first miscarriage, I wasn't that surprised. I thought, okay, like this happens to so many people. I've talked about this. I talk about this every single day. And so I'm just going to, move forward with this. And I kind of compartmentalized my grief and kept going. And then when it happened a second time and a third time, I think it started to hit me differently that we were having these conversations and that I wasn't taking care of myself in the same way. And so we ended up doing fertility for what is now my 7-month-old son. And we were able to be successful in that process. But even going through the fertility process, I think when you are a patient and living it and experiencing it is so different from being a clinician or a provider and talking about it. And so I just think it in a way helped me connect with families in a completely different way. And, being a lost mom, I think also I always had an advocacy and a real kind of passion to be in it with families who were experiencing loss and just felt like I had the tools to help people. But I think going through it as a person and as a patient yourself, it just sparked the desire to make this a true kind of life mission and make sure it's a part of everything that I do.
Absolutely. Thank you so much, Erica, for, sharing your heart with us and your story and just for all the work that you are doing. Because, being someone on the inside, not just from a clinician standpoint, but that compassionate, empathetic person, because you've been through it, like you understand, from a deeper level, but like you said, having to compartmentalize so then you could perform your job while you're going through it, but then also being there for the families and being so selfless and putting them first. Just can't thank you enough for all that you're doing, for fellow loss survivors and things like that together.
Well, thank you.
Yeah, absolutely. And I think the hardest thing for my husband and I too, after we lost Brooke, outside of, grieving and the trauma and everything, was realistically not wanting to feel that out of control feeling again, like we did in the moments of delivering Brooke and, the NICU, all of it.
Yeah.
And so we wanted answers, we wanted to seek out as many specialists as we could, at least I did, and getting detailed answers. So I think opening that dialogue up about what genetic counseling and testing looks like and all of that is just so important, because it was a journey that I didn't see us venturing down, but we too were dealing with, secondary infertility and things like that. And I'm so grateful that it's finally, being talked about more and more, and people are opening up to help one another, and to feel that sense of connection. So, do you mind sharing about what it looks like, to be a genetic counselor, shed some light on your occupation and what it looks like day to day?
Yeah. I think there's also so much to even just unpack with what you said, but
Right.
the day-to-day of genetic counseling can look, different for everybody. So being a clinical genetic counselor, you kind of train to operate in 3 different specialties, one being prenatal, one being pediatrics, and one being cancer. In the prenatal facet, we've certainly learned that there's so many different subspecialties this taking care of people who are wanting to be pregnant and being pregnant, and their journey to being parents. And so that you have genetic counselors that work in the IVF space, in the REI space, in the general kind of OB, MFM, fetal space. So it's kind of everywhere, which is good. But at the same time, there's also not a lot of access to genetic counseling services. So you're going to have a lot of people that are listening or that are in your groups that have never really had access to a genetic counselor. And that can be like confusing as well, I think, because a lot of people have had access to genetic testing. Our day-to-day typically it involves, especially if you're patient facing, is meeting with families, either pre-test counseling. So maybe they're coming in because they are wanting more information and they're trying to get pregnant. And so they want to do maybe something like carrier screening to learn if they are carriers of genetic conditions that could potentially impact a pregnancy. Or maybe they are loss survivors and they're trying to figure out, outside of carrier screening, is there something genetic about me that maybe contributed to multiple miscarriages or to a loss, or maybe structurally with something going on with the baby that contributed to the loss that we want to kind of take a look at more. So sometimes we'll meet with families in that space and kind of work through what are our testing options. What might this information mean for you? What information do you want to know versus not want to know? And kind of like, what are the steps to getting that information? And then a lot of times we're also working with families day to day on kind of the results that come with all of that testing and kind of breaking it down to say, this feels like a different language because genetics is so complicated and nuanced. It's different for every single family. One result means something completely different to each person that you're sitting across. And so really you need that kind of person-to-person connection to say, okay, this is what this result means to you, means to the context of your baby or the context of your intended family. And, that is kind of a piece of my job, is really breaking down the medical information, creating it in a way that's digestible for the family, and then also empowering so that you can move forward and feel like you have this extra piece of data to kind of like help your process. And just like you said, a lot of families are coming in at different points, like some people are information seeking and maybe the other partner is not information seeking at that time. And so a piece of our job is also the counseling aspect of kind of getting on the same page of like, what do we want to learn and what feels the best for us in terms of moving forward, so that we're not, you can't take the information away once you get it. So how do we make sure that we're making these decisions in an informed way that feels good for what we want to do as a family?
It's so beautiful that you're saying we, like being a part of, their team, and it being that, that we're on this journey all together, because realistically your care team, you trust them with your future baby or current baby, lives. And it's just like feeling that especially when news might, be heart shattering and things like that, or they have experienced a loss and they're looking for answers and all of that. So I just appreciate you saying that so much. But yeah, it's a lot. It's a lot to take in, but you actually breaking it down and why to seek, genetic counseling and testing and things like that is just so important. And that leads us in, like, why seek out, a genetic counselor? You touched on it, but what does that process and testing really look like when
Mm-hmm.
you're in the midst of all of it?
Yeah. I think going back quickly to the we part, I think it's such an important piece that we often don't feel like we have autonomy with, but that I always really advocate for is that just like with a therapist or a counselor, you should have some agency in picking the genetic counselor that you want to work with, because it should really feel like a trusting team effort, because this is someone who hopefully is going to be there in support of you. And so I think sometimes we, just like with, doctors that we see, you're kind of assigned to one person. And I think it's always
Right.
worth like looking out and trying to figure out if you can see someone else, if they're not the right fit for you. And there's a website called the National Society of Genetic Counselors. It's nsgc.org. And there's a link that says find a genetic counselor. And so you can find people that are even virtual around you. But I'm just putting that plug out just to say, like, make sure you have the we, because it's so important.
Yes.
And then I think, kind of getting back to the question, if we think about, like what does it actually entail to do genetic testing and genetic counseling? Really, it is mostly a conversation. You are referred from an OB or an MFM, and you're either meeting in person or virtually with someone and going through a little bit of personal history, family history, medical history. And then the testing itself is either a blood test or a saliva test. So it's not something that's super invasive. Now, if you are pregnant and you are wanting to get information ongoing, can be a little more invasive, because you may need to do a procedure like a chorionic villus sampling, which is something also known as a CVS, which is done in the first trimester, or an amniocentesis, also called an amnio, that can be done in the second trimester. And those are diagnostic tests where we're really getting genetic information from the baby. And those are kind of the areas in which we start talking a little bit more about risk, benefits, et cetera. But typically the counseling appointment itself is really kind of just conversation and deciding what steps make the most sense for you, and kind of game planning what different testing options might look like at whatever different phase you're going down.
Yeah. And that makes complete sense, Erica. And, you couldn't have been more spot on with making sure that the care team that you have in place is right, and that you are consulting, and it's not just that you're assigned this genetic counselor because you're at this hospital system and they say, here's one and this is who you're going to use, but realistically feeling like they're so submerged in everything that's happening, everything that's going on, with your future planning, and that you can feel comfortable sharing things with, because to educate, to advocate for yourself, you need to be able to ask those difficult questions, and, be able to receive the difficult news back from the person that you're trusting. And it is having that open dialogue and just feeling so like that sense of security and safety with them is so important. So I'm grateful that you said that.
Yeah, I think about it in this, our population of patients, right, in such a different way than other people, because I just feel like the trauma-informed care and the extra kind of TLC is so important. And we've learned through loss, like there's so many times in which the experience is dismissed or not understood, or not thought about in the way that we need. And so I think it's so important, and it just strikes me in such a more like important way to be like, you have to make sure, just kind of like with the concept of rainbow baby clinics, like you really have to make sure that you're getting the providers who are going to listen to you and understand that you need different care than other people, even though of course we should all be providing people with the, expert respect and care, but like you may not get that everywhere. And so we really got to find your village. Right. And I just think it's so important.
It really is. And that trauma-informed care piece, we not only do we have, people with peer experience, lived experience and things like that on our volunteer team, but then we go through that training because these are traumatic losses, and it's anything from infertility, through infant loss, every stage, every age, because they are traumatic losses. And then it's like, how do you process? How do you sit with it? How do you, continue to, live life after hearing or, experiencing these things? And it's so important. You being a care provider and saying that, because, a lot of times in groups and in settings, we talk about someone almost being a little desensitized that is in the field because,
Yeah.
they sometimes experience more losses than they do births in one day, or,
Yeah.
delivering bad news more than good news in a day. And it almost does, get them to that point. But realistically, it's so close to the couple that you're,
Mhm.
dealing with, or the person that you're dealing with, and treating, that it's not for them. It's their personal experience. And just hearing that means so much.
Yeah. And I think you can never, your experience as the clinician is certainly your experience that you take home with you, but it's not the experience of the person who's going through it. And the person who's going through it, that is their everything. And so you have to treat it that way. And so that's why I think a team that can understand the different anxieties that naturally come with pregnancy after loss, or just every piece of it, I think is
Right.
just so unique, but so needed.
It is. And just feeling validated and heard is so important from your care team. Really
Mhm.
is that, instead of, those throwaway comments, or,
Mhm.
just like brushing off, things. It really is. And so I just can't thank you enough for, being just the way you are with patients. It's so beautiful to hear and refreshing. So, yeah, like that kind of leads us in. Like, how do you, I know that you get referrals from OBs and maternal fetal medicine and things like that, but how does a genetic counselor then kind of fit in to the whole experience with the care team?
So, in the most ideal situation, they are
Yeah.
a big part of the care team. I think about it as kind of, uh, in the most simplistic way, kind of like a triad with the family, the physician, and the genetic counselor. And they're really kind of listening to the family's needs, listening to what they're hoping and wanting from their lens of genetic testing, and how that may fit into their path and at their point in care right now. And the genetic counselor is kind of the liaison to give that information to the physician and say, hey, this is what we're thinking. This is the plan. The physician is giving information back to the genetic counselor to say, this is my input from maybe when I'm in their medical history, or in their ultrasound if they're pregnant, or however, whatever phase of this journey we're on. And the genetic counselor is able to be with the family to kind of help digest the information that's coming from the physician and from the genetic testing, so that they have somebody who has a little bit more time and who can kind of slow things down and break it down however they need, because it's all a complicated process, and it's all hard to figure out how it sits together. It doesn't matter what kind of walk of life you're coming from, or if you're a physician and know this stuff, it's still a different world when you're talking about genetics.
Oh, it really is. And understanding that lingo, like you said, because, getting back those reports are very overwhelming. When my husband and I had it done, like I was like trying to like read and understand. And even though we, weren't showing any dominant or recessive genes for different things, it was just like fully understanding, what does like genes mean? What does this mean? And like, how does that fit into this? And what does that look like? And what's the probability? And all of those things. And it's just like a flood of information. And it can be extremely overwhelming when you're already, depending on
Mhm.
your situation, dealing with overwhelming anxiety, moments already.
Yeah.
You're so spot on. Yeah.
And I think it goes into, and this may be a question that we're going to, but like, why do people pursue it and why do people stray away from it?
Yes. Tell us why. Yes. That actually is our next question. So what a perfect lead in, Erica.
Perfect.
Yeah.
Well, so I
Yeah.
think that, because I think when you are overwhelmed in the moment, like, especially if you've just experienced an infant loss or any type of pregnancy loss, you're like, well, my pregnancy, maybe your pregnancy was perfect. And you're like, so what,
Right.
there wasn't any concern for anything genetics. Like, what's the point of this? Why do I have to go through another test that's just going to tell me who knows? And I get that. And I think there's also some stigma and guilt, right? When we think about genetics, to be like, oh, what if I find out something came from me or it's my fault?
Yes.
And so I think people really shy away for a few reasons. One, they may have attending care teams that are like, it probably wasn't genetic. You don't need to think about that. which is fine, but we don't know. And so I think when I view how genetics can fit into a family, I really advocate that we should explore it, and we should explore what test makes the most sense for where you're at. I always say, and I teach a lot of students, and I always say you have to think about the family in front of you, because there's never going to be a textbook answer for what we offer for our families.
Yes.
Something like, okay, carrier screening for a future pregnancy. We didn't do that, or we didn't do an expanded version of that the first time. And maybe having that information that says, hey, we're not carriers of conditions, and we can know going into a future pregnancy, that's one more data point to say, hey, we have a little bit more control of this moment to say this may not happen to us again, or at least maybe it's not related, but at least other lightning strikes won't happen to us again. Or can we find out the reason why the loss happened? If we think about the literature for infant loss and why, the cause of stillbirth, we don't have great stats to say why stillbirths happen. And some of that is because we haven't done our due diligence in the way that we need to of providing things like genetic testing, or having that accessible, or even just having the technology available. But we have it now. And so we really should be exploring for our families. Let's just think about all of the causes that can happen. And sometimes sometimes those conversations need to happen kind of in the moment. And if they don't, then we don't have the ability to do that. But there's always kind of other options that we can think about to kind of give families some information. And I really think that information, even if it comes back with something that is heart shattering and that we need to work through, I still think that can be so powerful to prepare us to say, like, what's our next step? And do we have this information to help us understand if this is ever going to happen to us again? Because isn't that what we're all thinking of, like, as clinicians and as parents? Like, I can't be in this space again.
Agreed. And I just did not want to be blindsided again by
Yeah.
everything, and it really was that. And just feeling like I was in the dark. And because, like, when we were going through, just, speaking of Brooke and that
Yeah.
situation, it really was like in that moment, like, oh, you have to go into delivery and this and that. I had no, like, in that moment, I couldn't think about anything else.
Of
And
course not.
from a practical, right, standpoint, or even digest anything, I mean, I had doctors like repeating themselves, because I was like, wait, can you explain that again? And not that I don't have like any certain amount of knowledge, it's just
You can't
and
process
that,
it.
yes, you can in that whirlwind. And so exactly, Erica, having it ahead of time, and or talking it through in a setting that isn't in that overwhelming moment, with somebody who gets it, and can really break it down for you and
Mhm.
take that time and not
Mhm.
just feel like you're being shoved off.
Yeah. Yeah. And I think there's so much proactive work that we can do. And certainly, I can think about parents listening to this and being like, well, no one had that conversation with me. Or in
Yeah.
the moment, of course, I wasn't thinking about genetics. And, I don't ever want people to feel bad about that, because that's certainly not your job as the parents. But I think even from a clinician end, like, we need to be doing a better job of saying, like, hey, we're going to get a blood sample from the baby, or we're going to get a piece of the umbilical cord or something, and let's just hold it. And if you decide that genetic testing is the right thing for you, then we have that information and we can move forward. And I think that, as we continue to advocate, and as you continue to do this work, I think hospitals are hearing this, and people are being more proactive. But I think it just wasn't always a part of the conversation, and it rids our families of the ability of finding out that information about their baby, because we don't have our babies to take home in the same way and get more information on. So
Absolutely.
it's just heartbreaking and so important.
It really is. And you're right, Erica. I mean, if our clinicians, let's say, for example, aren't going to do this proactively, if our survivors can then go in educated, right, and
Mhm.
know what to ask for, because that was like half the battle for us. We didn't know what to ask for in those moments, like what we could or couldn't do. And because you don't, unless like,
Mhm.
because this was an
You don't.
experience that we've never had before.
Of
And
course not.
so, like, going in there knowing, okay, this is like a realistic ask, and this is something that we can do.
Mhm.
Let's do it, because, as losing Brooke, I couldn't imagine doing it again, right? Like
Mhm.
experiencing that again. And if it was something genetically, a disposition that we could have seen or something that was genetic, okay, well then can we start the conversations around what does a surrogate look like? What does, this look like? Because in that moment, I could not handle it again, like from a, like just thinking it through and going through that whole experience again, that whole trauma. It's like, how can I put myself through this if like I had this knowledge of going into it? Does that make sense?
It makes perfect sense. And
Yeah.
I think I think it's so brave to think about building a family after loss.
Yeah.
Experiencing a pregnancy after loss is we know is a traumatic process. And so
Yes.
anything that we can do to give data points to minimize that trauma for a family is what we should be doing and is so important to do.
Oh, well, and that just leads us into, our last point that we wanted to talk about today. And that is like, how do you console couples like when you are giving that heart-shattering, heartbreaking, news to them and looking at different options and, trying to create this plan with them and being with them? Because just to say, from my husband's and my experience, just to touch on that, we almost felt like it was like, here's the results and like, that's it. And like, good luck, and we didn't have
Yeah.
anything that was, major or anything, but it still was like, whoa, this is a lot to digest and take in. So, yeah.
Yeah. And I think that's so many people's experience. And it's so hard to hear, because I think the piece that is so important is like we are humans as clinicians, and we are
Yes.
humans as people and as patients. And so like it is just a human conversation. And I always think, how would I want to have this conversation with my sibling, or how would I want someone to have this conversation with me, right? Like
Right.
just treat people in the way that you want to be treated. And so but I think it speaks to people are afraid to give bad news. No one wants to give bad news.
Oh, right.
Right.
100%.
And so
Yeah.
I think that until you get comfortable with it, and some people maybe are just never going to do it in the way is comfortable for them. Experience, unfortunately, really helps have the conversation of saying, like, I know how I would want to receive this information. And I know that having an honest conversation and knowing that there's trust built beforehand in the first or last time that we're going to have this conversation, like brings the anxiety level so much down so much for both the patient and for the person giving the news. And I always think about it as like, if I'm giving someone bad, it's not news that they want to hear, and it's not news that I want to give, but it is my job to give it in a way that is not going to cause them more trauma. And
Right.
so we are going to always have to talk about the bad news. We're going to process that and let that sit. And maybe that initial conversation is a really just, I have news that I wish I didn't have to give you. Or I have news that we really weren't expecting, and we talk about it. And maybe that's all we talk about for that phone call or whatever, or that in-person visit. Like, we're just going to sit with this, and we're going to sit with the fact that this wasn't what we were hoping to hear. And we're going to know that we have options and we have a plan to move forward, but we don't need to talk about that today. Right? There's always an ability to have another phone call. Like, I mean, that piece drives me nuts, because
Yes.
why not? Right? Like, I don't know.
Yes.
It feels like it's not, you don't, and I know that that's out of some people's control, but like, there's always the ability to reach out to someone. And so I feel like the information does not always need to be given at 100% at the time in which you're giving this news that is going to rock someone's world, because they're not going to hear it anyway.
Yes.
And so it's our job to just sit with them in that, just like we sit with every other grief that we live with, right? Like, the thing that's most powerful is just to have someone sit there with you. And especially if it's a person like a genetic counselor who you don't know very well, or maybe you've just met them for the first or second time and you don't have that trust with. And I can tell you, I've taken care of thousands of patients. Not everybody has the trust in me. And there are sometimes where those, it is uncomfortable, but grief is uncomfortable. And it's and people are mad at me for like giving the news. And I understand that, right? Like I have to take that on, and I have to know that they're not mad at maybe me as a person, but they're just mad at the situation, and I'm fine with that. I always say I'd rather you be mad at me than, your mom who you're going to call on the way home or something like that, because grief is going to come out in so many different ways. But it's my job also to make sure that you have the next piece of things, and there's always options. And for some of our families, when we're giving, I would say the news that hits the hardest is we know why this happened, but we know that there's a chance that it's going to happen again.
Right.
And that happens, a fair amount of the time, where we have rare recessive conditions that we know we get a positive result back, and there's about a 25% chance it happens again. And in those instances, there's lots of options we can think about. Sometimes we think about IVF, and certainly families financially, religiously, emotionally can't and don't want to go through that. And so then we talk about, okay, if we're going to try spontaneously, let's talk about that. There's testing options. There's ways we can know earlier. There's ways that we can create support around us in any situation. But like, you're not going to get pregnant tomorrow with this information, because we're going to need some time to just think. And so like, we can just be for a day or, a week, and kind of like figure out what our options are. And if somebody did get pregnant in that time, that's okay too, because you can't do any testing for a little bit. And so we have lots of time to kind of like build our support system around the information that we have.
Absolutely. And like you said, it is just knowing and going into it, like, and treating somebody like, okay, let's break this down, because it is a process. It's not just like, here's the results and that's it. Like, okay. And granted, our results that we got, it was like recessive on my husband's side, one little thing that didn't really matter, but it was like, but that's how they made me feel about it. And I was like, well, I have a lot of questions, and, but for somebody then to say like, okay, this is why. And like we sought out somebody else to kind of explain it to us. This is why it's not, and this is why they didn't go down this. And I was like, well, thank you for taking the time to do that, instead of just like, oh, well, it's not a big deal. No, like, because it really is. And then when you get horrible, heart-shattering news, and it's like with somebody though who can actually take the time to process it with you, sit there with you, listen to your concerns, listen to like all of your hopes and dreams that just got completely it means something, instead of just feeling like you're getting, just washed away or pushed under the rug kind of thing.
Yeah, absolutely. And that's why I think it's so different to take care of our patients who have experienced loss, because I think that hearing anything, even if you can say, oh, that's not going to be something that you need to worry about, you're worrying about it, because everything that you've experienced is something that no one thought you were going to have to worry about. So I think it just goes back to like, you have to have that understanding. And it doesn't have to be that somebody has had a lived experience. It's just that you have to have that understanding that like, for the person in front of you, that's important in a different way than maybe somebody else who could care less about the testing because they just like thought it was interesting to do.
Yes. And saying like your concerns, your feelings, your thoughts out loud sometimes takes the power away from them for you, where you're talking about it in a setting with someone who fully can understand and then also talk through it with you, instead of saying those like throwaway comments like, don't worry about it, it's not a big deal, like da 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 da. No, like that's not making me feel any better, because I still have these concerns and I need an education on it, or like an understanding to fully be able to then, okay, I can let this go, or like I need to venture down this path a little bit more to figure things out and to make the best decision for me, my baby, my, family, futuristically, or what's happening now. And it's so true.
Yeah.
Oh, Erica, well, I can't thank you enough. And just for our listeners out there, Erica has agreed, to be on here again. If anybody wants to write in on our Cried Out Loud podcast website, to go ahead and ask questions, or to seek out, further explanations on anything, or if you have any questions, please do, because she would love to come on again, and we would love to have her. It is just so important to have someone who is that compassionate, empathetic, care team member that is a part of your journey. So we just can't thank you enough, Erica, for your expertise and you being willing to do this for us.
Oh, of course. I'm so happy to partner with you. And I thank you so much for doing all of this work for all of our families and for Brooke. And so yeah, thank you so much.
Oh, thank you, Erica. That just means the world for coming from you and for having you on here. So thank you. And, thank you for tuning in, and please follow and subscribe to our podcast to help us reach more, fellow baby loss survivors. And we are always with you, baby loss survivors. Until next time. Thanks again, Erica.